thank you to organizers for this excellent meeting. I would like to show the work we have been doing in 5 pathology departments in the province of Cadiz with a specific problem, which is dealing with breast cancer. And the idea is to try to find different patterns in breast cancer that can help us in a better identification for prognosis, and of course if it can also help in our diagnosis. For instance, in those repetitive tasks of evaluating the biomarkers or trying to detect minor areas of metastasis, of minor or small areas of tumor. We have already seen that there are several good examples how deep learning are helping us to do this kind of task. And we did this work about, we started this work about 1 year ago, and we're going to show these results of 1 year work. First, we developed a web platform aimed for this collaboration between the 5 hospitals, and then we realized that some of us, we had a 3D STEC scanner, and one other hospital had a Rojo DP200 scanner. So the first thing was to do was trying to normalize the different formats, which is more or less easy because you can export. But then we decided that the format in which we were going to work was the DICOM format, and we planned to do all the image analysis and all the work on these DICOM files. So first you get the proprietary format, for instance, in 3D STEC, and then we could convert them to DICOM thanks to the work in collaboration with David de Mena and also with the BC Lab group in Ciudad Real. Okay, the good news is that with the Rojo DP200, we had the possibility to generate these DICOM files directly without a previous conversion. So this work was done later, but the figures, the results I'm going to show now, are only based on the images that were converted from the 3D STEC scanner. So this is a neutral digital slide viewer. And another main objective was that making a annotation should be very easy, because these annotations are not only done by pathologists, but also by very well-trained technicians. And then we had, of course, to validate the results of these deep learning algorithms. And with the global idea was not only to generate a platform to do annotation, or let's say to do a platform to have a very good deep learning platform, but our final approach was that in the next step that we will show later, we want to integrate and to correlate also not only with clinical data, but also with genetic data that we are collecting from these cases. But the first goal was, are we able to separate, to locate tumoral areas, to separate them into different patterns, and how these patterns correlate with the classical morphological patterns of ductal carcinoma, lobular carcinoma, and so on. No? And for this, our engineers decide to use the DeepLab V3+ neural network, because it showed very good results for segmentations, and also to alienate and to separate very well the tumoral areas, for instance, from the background or from the stroma. And in fact, what the pathologists and technicians did was selecting and annotating very highly and very hard work to do in, we will see now how many tiles we did annotate, and separating also if it was infiltrating lobular carcinoma, ductal carcinoma, And this work has already been finished, and the next work we are doing is adding this adding information like the presence of let's say, vessels, what areas corresponds to adipose tissue, what areas corresponds to stroma, because in the literature we already have seen that there is a very an importance of the stroma, also, and not only of the epithelium. But the first work I will show you is only based on the result of the epithelium. The work on the stroma will be done later on. On all cases, of course, we've got anonymous information, but all the clinical data, including the treatment, including staging, including pathological findings, and so on, so that it is very easy to correlate what we are reviewing during our annotations with also the clinical and the pathological data. Additionally, we also have immunohistochemistry, which also helps us a lot when you're trying to do annotations. In fact, there are some vendors that are able to do this registration, this linking between emactocillin and immunohistochemistry automatically, and then they can spare and they can avoid doing this manual segmentation, because they can automate these segmentations thanks to the information to the immunohistochemistry. I think this is a very good approach. We are not doing that, but I think we should also work on that. So these are essentially our first results, because the system was pre-trained with a previous data set, and then we did additional training with 400 fields of view that were very heavily annotated. You can imagine, for instance, in an infiltrating lobular carcinoma, the hundreds of annotations you have to make just from one single, maybe, field of view. No? And the accuracy is quite well, over 90%, but you see the sensitivity is still low. And this is why we want to add additional parameters like finding in the stroma, of course, training more cases and more tiles in this platform, and we are sure that we could obtain better results in the next phase. These are some images showing how we are trying to separate benign from tumoral areas, how we are trying to separate infiltrating lobular carcinoma from ductal infiltrating carcinoma, and how the system is behaving really well, also to trying to do this work for us. And this is the result that we obtain. After you run the algorithm, the system is able to locate where the areas of carcinoma and the different type of carcinoma that it's able to find. In conclusion, the platform, of course, is quite efficient in this collaboration between 5 hospitals, and it shows that working with DICOM images doesn't make any real difference than working with proprietary images, and now it's enabled us to generate more and more data sets that can allow us to do our next work. Our next work is correlating all these morphological patterns with the genetic data. We know that this is very important. For instance, we know that the difference between lobular carcinoma and ductal carcinoma is the E-cadherin, is a mutation. And also in other type of tumors, for instance, in triple negative cancers, it has already been shown that the different patterns inside this type of tumor is also correlated, for instance, in this case, with the mutation of BRCA1. And our idea was then trying to analyze all the patterns that we can have in the different set of patients that we have. We have 109 patients, and from them we collected 218 specimens. And at the end, we are going to, we are already analyzing over 1,000 digital slides, and we plan to correlate this with the information that we already are having from these cases. We have already finished the the sequencing of these cases using a commercial and combined comprehensive assay with over 160 genes, because we have the hypothesis that by finding these different patterns with deep learning, we will be able to select better which are the areas in breast carcinoma that really are worth to be analyzed by genetic analysis. You know the problem about tumor heterogeneity. One approach will be that focusing on deep learning and focusing on morphological data, we can do better molecular test for our patients. So this is what I wanted to show you. Thank you.
Thank you very much. Any quick questions? Can I just ask what you do about variation in section quality? Because one of the things that is a bit of a problem when you do these kind of annotations is that you're going to have a lot of differences in section quality once you get into the real world.
Yes, of course, having 5 different hospitals, and even in the same hospital, it happens. No? We didn't find this was a problem. After 100 cases that were trained, the results were improving. So for us, it's a matter of training the system with all these different kinds of results in staining that we are going to have. There are a lot of artifacts, for instance, in immunohistochemistry, and then we also are trying to train the system and tell the system, this is really an artifact and you should. So it's a matter of, from now on, we are doing by hard work and doing a lot of annotations.